Hello, and thank you for coming to my channel. My name is Sarah Manu, and today I'll be teaching you how to set up an arterial line. There are three parts to this video, and the first part is learning to put the whole pressure monitoring set together. Secondly, learning to spike and pump your bag, and lastly, learning to flush the system. I hope you enjoy this video and continue watching.
Assembling pressure monitoring set. In this video, there are some parts I would like for you to get familiar with, and they are the rebreathable cap and non-rebreathable cap, the three-way stopcock, transducer with a cable port, and an 84-inch line. I'll be using these names as we move along. There are 4 items that you need when you are assembling a pressure monitoring set, and they are the transducer clip, a little closer so you can see it. And you need a pressure monitoring set, and the name is always in front of the package along with the expiration date. You also need the arterial sticker, and it's orange in color, and the 96-hour sticker. And the 96-hour sticker goes onto the lines. And a little closer look. So let's go ahead and place those 3 items on the side. We don't need it right now. Now pull back your pressure monitoring set and go ahead and open it. The opening edge is right there on your left hand side. Just ply it open, nice and smooth. All right. Once you open this package, just go ahead and take the product out. It comes with 3 different packages, and they have the push caps and the non-rebreathable caps. Okay, so a little closer so you can see it, and put those 3 packages on the side, and grab your product. And it's wrapped in some kind of white paper. You can just go ahead and untangle it. Okay, this goes to the bag, and that's the 3 pigtails. And this is the stopcock. So this is what we're looking for, okay? We're going to go ahead and take that navel or umbilical line off, and take that rebreathable cap off from that short line. Do not put it back on the stopcock, okay? That's not where that goes. So you go ahead and unscrew your stopcock off the 84-inch line, and unscrew the 84-inch line from the transducer. Once you do that, put the 84-inch line on the side. Now screw your stopcock into the transducer before you put your 84-inch line into the transducer. Once that's done, go ahead and push your rebreathable cap onto the 84-inch line, and twist your valve that is on the stopcock and the transducer up, and unscrew those 2 caps from the sampling port. They have holes in them, so we're trying to stop any fluid from leaking out of these ports at this moment. So grab your caps that came with the package, and grab at least 2 or 3, because you need all of it except 1, okay? So just grab some out and cover the sampling port with these caps, and do the same for the stopcock. Now, once you do that, twist your valve facing the sampling port. So grab your 3 lines or pigtails and go ahead and close all the pegs that are on them, so that no fluid will leak out when you spike your bag. All right. Once these are done, go ahead and take off your rebreathable caps and replace it with the non-rebreathable caps. And do that for the other two pigtails as well. Just take it off and place the caps. It's just a twist motion. Don't do it so tight that the provider cannot open it. Just a little twist and that's it. So place those three on the side, grab back your transducer and bring out the sticker that came with the caps. Okay, we're looking for the arterial sticker, which is the red one, okay? So peel the arterial sticker off and then place it just in between the blue silicone string or the flushing string and the transducer valve. Just place it in between it. This just help identify that it's an arterial transducer. And then grab your cable port, and at the back of the cable port is smooth, okay? Go ahead and use the red sticker and stick it just behind the transducer port. Nice and smooth. That's completed. And put the other stickers on the side for another transducer if you have been asked to do so. So grab your other push caps that came with the package. We're looking for the red push cap because we're doing the arterial, okay? Push the cap into the valve. It goes in nicely. And repeat the same for the stopcock. This process is only helping the provider to identify that this is an arterial line transducer, just in case there's so many transducers that he cannot figure out which one is which, okay? And those are the three pegs that goes to the patient here, and put your stuff on the side. Grab your arterial sticker, it's the big orange sticker, and then peel it open. Stick it just right on top of the stopcock and the 84-inch line. Just fold it into two so it stick together. Nice and neat, no wrinkles. And go ahead and move towards the other side to the chamber. Grab your 96-hour sticker, and here you're going to do the same thing that you did for the arterial sticker. Just place it from the three little pegs or the three lines or pigtails, whatever you call it, and the chamber, and just fold it together so they will stick nice and neat. And on this sticker, there are some important information that you need to make sure is filled out here. And that is your name and when the bag was spiked and when the bag needs to be changed or the lines need to be changed, okay? This is very important. Do not forget to fill this out. That's done. Put it on the side and inspect your work. That goes to the bag. You have your sticker. You have your pigtails closed. You have your transducer and your stopcock and your port. So grab your transducer clip and just go ahead and slide your transducer into the clip. You hear a little click. It just shows you that, hey, the transducer is nice and stable. And at the back of this transducer, there's a red slide clip at the back of it. It just helps you to identify this is a transducer for an art line, okay? And it looks like a little alligator mouth, the clip. That's how it looks like. And there's other three ports to this clip where the other three pigtails can go to whenever you are asked to add other 3 or some kind of transducers to this arterial line, okay? Your work is nicely done here. Inspect it if you want, but please make sure everything is nicely tied on. And just go ahead and put that on the side. We are here on the spiking of the bag. Go ahead and grab yourself a sodium ml bag. It's a 500 ml. And the name is always in the front. Please check, because sometimes it might be a different name. It might not be the sodium that you're looking for. So check the name. And the back has no writings on it. So there's 2 ports here. One of them is where you will spike, okay? And this is the chamber. You use it to spike that port. So the other one is also the injectable port for medicine. Just grab your solution sticker. Make sure you fill out this solution label. Please put your name and the day and date when you spike in this bag. Just peel it open like any sticker and stick it just right underneath the 500 ml. This cannot go on really smooth, but just try your best to make it look neat, okay? And that's done. Please make sure you're doing this in a clean area and you're not touching everywhere, just for infection purposes, okay? We're trying to keep the stuff sterile. And this is the 500 ml pressure bag. And it always have the 500 behind the pressure bag, okay? And it's right here, a little closer, 500 ml, and it matches your 500 ml sodium. So you know you picked the right bag, okay? And just go ahead and grab your chamber. The tip of the chamber is very sharp. So whenever you spike in, please make sure you de-air the bag first before you insert the whole chamber, okay? So there's a little bit air, I hope you can see it. I'm just bringing the water or the fluid out a little bit so the air can come out, and I'll go ahead and insert the chamber. All right, like I said, at this point, you're trying to make sure you don't spike anywhere on the side of the sodium because it's very sharp. And if you do that, you have to change the bag again. And that's not what we're trying to do here. So take your pressure bag and slide your hand into it. And then take your sodium bag, slide it into the pressure bag, and pull it all up inside the pressure bag. And there's a little hole on the sodium bag. Just slide your string from the pressure bag into it. And turn your pressure bag. There's a little, almost like a 3-way stopcock. Just turn it towards the sampling port or the sampling air port, and then go ahead and pump air into the pressure bag. When you pump in it, there's a measuring meter behind the bag, and try and take your injectable medicine port out. So when you pump in the air, it does not get stuck inside the pressure bag. So that's the meter I'm talking about. We're trying to get the pressure meter to at least 150, and it will turn into a red color. So just keep pumping and just pumping. This process is a little tedious for my hand here, so bear with me. I'm trying, okay? I might put it on the table just to get it, going, so you can see that red meter I'm talking about. So I'm not sure if you can see it, but there's the meter is coming along. There's a green one that will push out first before the red. I couldn't get it all the way, but I just went ahead and turned my stuff up. Now you grab your transducer, and this is all done. Your spiking is done. Your bag is ready to go into a room, okay? Just take up all your trash and stuff and put it in the trash. And grab your transducer clip. You see what I told you guys? On this clip, there is no red slide on here. But always know that it goes onto the first port. Alright? So grab your transducer and slide it into the first port. The first one. And it's 4 of them. So you always need the first one that faces the alligator mouth or the alligator clip edge. And that's how it goes in. Click. You hear the click. You slide it. Pick up your stuff. You are done. You're ready to go into a room and hang it. When you get to the room, the pole always rotate on the top. Okay? Make sure that the level that you place in the transducer clip is almost in alignment with the patient's heart. And if this bag or your pressure monitoring bag is like in front of your clip, just rotate it from the top so you can put it on the side and it's out of the way. Just like I did it. And then come back all the way to your clip. Make sure that it's away from the clip. So to do the flushing, you need like a gauze or a quickable to do this flushing. And you have to keep your stuff sterile. So you pick the pigtails first and then go ahead and open one of the pigtails one at a time. One, and then you will see that since when I opened this, because it's closed, no fluid was coming out. So I just go ahead and close it back so you can see it. And I open the clip before I open back the pigtail, just so I can get a little bit fluid. I'm not sure. I hope you can see this part. There's a little fluid that came out, and then I clip my peg back close. And then I repeat that same process for the second one. And whenever you do that, just go ahead and make sure that your clips are closed, because this can get very messy if you don't follow this step well. You just open your peg and fluid will leak out and close it back. You're just trying to get the air out so there's no bubbles in the line. That's what we're trying to do here. Okay? And that side is all done. The pegs have been flushed. You're moving towards the bag. So now you go to your transducer. And you see there's another peg too, just under the transducer. You open it. And when you turn the 3-way up, from the transducer, the valve up, you can go ahead and pull your blue silicone string and fluid will leak out of it, and then turn it back onto the sampling port. That just shows you that you're done flashing that port. And do the same thing for the stopcock. Twist the transducer, twist the valve up, and then pull the string and fluid will leak out, and then twist it back towards the cap or the sampling port. And make sure no fluid is, running anywhere, and keep it sterile, okay? And just go to your 84-inch line, hold the blue string, pull it till you see fluid and all the bubbles out from this 84-inch line. If it's not coming up that fast, just pump more air into the bag, and the meter like I showed you earlier, you try to get to the meter at all time. So there's a green color that you see, and I'm just trying to get to the red meter. And there you see that red that just came out. So I go ahead and pull my string again, or the flush string, and water will leak out nice and neat. We all set here. Make sure your injectable port is out and it's not stuck inside the pressure bag. And you can see like drip, or the measuring, from the drip in the chamber. And everything is open. And turn your valve up onto the 84-inch line so that fluid will not leak out whenever you go and set this in a room. This is all set and done.
Hello once again. If you enjoyed the video, you are welcome to like or subscribe, and hopefully I get to bring you more. Thank you so much for watching. Have a great day.